Today I'm going to show you how to do trach suction and care. I'm going to begin with the suction portion and then go right into the care portion. For the skills check off, you will need your trach suction catheter kit, your tracheostomy clean and care tray, a bottle of fluid, an ambu bag, and you will need the vacuum suction and suction tubing like you did for the NG tube insertion. I'm going to take this and just tuck underneath the patient's arm, and I'll show you what to do with that. For the ambu, you will verbalize that you will have a helper because this was always a two-person skill. Your helper will pre-oxygenate your patient for you by giving 2 breaths right before you suction the trach tube. The 2 breaths are given 1, 2, 3, release. 1, 2, 3, release. Now you're just verbalizing. My patient will pre-oxygenate, or my helper will pre-oxygenate with 2 breaths. So this is just here at the bedside, just so that you know that you will need to have it actually for the clinical setting. Now, what you can do is put on some clean gloves, and you can remove the old dressing right away. And I just pull this out from underneath, ball it up, throw it away. Now I'm going to open up all my supplies. You will notice I put the trach care tray second and my suction kit first because this is what I will be dealing with first. Each set has a pair of sterile gloves. So you can just take this out, open up your suction. When you open this up, you will notice right away that you have a container here on top. And I'm going to actually turn this around so that it is facing me. And all you have to do is just pop it open by squeezing it. You can go ahead and pour in some fluid. And you can use this so that when you suction, you can clear your tubing. I'm going to set this over here. We're going to continue to open using sterile technique, and you will see your gloves are there. So you're going to grab your first pair of gloves, again, maintaining sterility. Find whichever hand you're going to glove first. Make sure you keep it above your waist at all times. And my thumb is on the other side. Then you're going to find your other glove and the other thumb. You're going to hyperextend your sterile thumb. Interlace your fingers. Now this is the suction tubing. So this is the portion that actually goes down into the trach. This connects to your suction tubing. So what happens is one hand remains sterile and one hand will become unsterile. I'm going to make my right hand sterile and my left hand will become unsterile. I'm going to connect to my tubing, and then I'm going to turn my suction on. What you will notice is that on the P part there is a hole. This is so that when you come out from suctioning, you can do it intermittently. It's only on the way out. This is sterile, this is non-sterile. You can also test your suction by testing it with water, making sure it goes through, and you're pipetting the hole. This is where you will verbalize. My helper will pre-oxygenate my patient with 2 breaths. Then you're going to go in with your finger off. It's not covering the hole. You're going to go straight in until you meet resistance. You're going to pipette on the way out, turning. All right, that's 1. You do it twice. You do the same thing. You go in till you meet resistance. You pipette on the way out, turning. After swiping twice, you will verbalize my patient will pre-oxygenate again with 2 breaths. You can clear your tubing with water again. 2 breaths have been given. You can go in again, straight in, till you meet resistance. Twirl on the way out, pipetting. Then you can do it again. You go straight in, on and off the suction, turning back and forth. and you're done. You can take all this, turn your suction off, disconnect. Now all of this can be balled up in your glove and go in the trash. All this can be thrown away. You will see in your care tray, there is a set of gloves for you, so you have another set. You can go ahead and take out this towel here. You can cover your patient, and this is just to keep the gown from getting dirty. All right, you can go ahead and you can pour your liquid in this empty tray here. All right, now sterile gloves. Again, put on whatever glove you want to put on first. Just maintain sterile technique. Need that to stay down. All right. Remember, keep your hand above your waist at all times. Hyperextend the sterile thumb. Interlace the fingers. In here, you will notice a trach tie. You have a split dressing. This is the new dressing that you have. You have 2 gauze to clean with. You have a brush to clean the inner cannula of the trach. You have these pipettes that you can use to help get the dressing underneath and also to put the trach ties back underneath the slot. And you have Q-tips that you can use to actually clean around the stoma. So you can wet your Q-tips, and you're going to go around underneath. You're removing any dry blood, any crustiness, any type of drainage or sputum that has dried, anything that is in the way that can actually go into the opening. And you can touch around with both hands, and you're cleaning all the way around. Then what you're going to do is remove the inner cannula. So you're going to hold down and remove the inner cannula. You just turn and pull out. Now, some inner cannulas are disposable. If that's the case, you would just pull this out, throw it away, open up the new cannula, and put it right in. This is non-disposable, so you're going to clean it. This is where you take your pipette, your brush here. You can wet it, and you can go through and actually clean. You can see how it goes through that very first hole there. You can bring it out. You can go through this way. And if you want it, you can actually take some fluid and pour down in here. Just make sure you point it down so it goes down into the tray. And then you put this right back in. So you have your inner cannula back in. Now what you're going to do is replace the trach tie. So you're going to loosen one end. You're going to keep your hand down on the trach device so it doesn't fall out. You're going to get your new trach tie, and you're going to put it back in the slot where it came from. And this is where if you have trouble getting it in, you can use the pipettes to actually help you put it back in. You're just going to create a knot. You're going to go around the patient's neck. You're going to undo the other side. And you're going to put going on this side here. Alright, the last thing you do is to replace your dressing. So the first thing you do is remove the dressing. The last thing you do is replace the dressing. And in a clinical setting, you can cut that to make the ends smaller, but that is it for the trach suction and care. And then you just throw all your supplies away.